Apologies about that. Welcome back. Sorry about the technical glitch again. We are learning as we go using Facebook Live. So good morning, everybody. My name's Liz Darlison. I'm Head of Services at Mesothelioma UK, but I'm also a consultant nurse at the University Hospitals of Leicester. We, as a charity, wanted to put on some Facebook Live Q&A sessions to give those people living with mesothelioma, their families, carers, and also healthcare professionals the opportunity to pose questions to us as a team of nurses. Some of the questions have come in before today, and if we have not got the expertise or knowledge to answer the questions that have come in, we do have a pool of experts all over the country that we have tapped into to ask their advice. So first of all, I just wanted to say I hope this finds you well, and I hope that you've been able to use this downtime that we're all experiencing to really focus on your fitness. And I want to thank Julie Roberts up in Scotland, who's been doing some videos for us that we've managed to post. So some exercise programs that have been posted on our social media sites. And please, I do urge all of you to do all that you can to get as much activity as is possible. Now, for some of you, that will be going out for a run, and for other people, it will be sitting in an armchair doing exercises. And Julie's created some really doable floor exercises for anybody to adapt to their level of function and activity. I also understand Joe Wicks has got some armchair exercises that you can also tap into. And please also have a little look at what the Meso UK team have been doing just to get the whole team motivated and look after our own fitness. We've been doing a social distancing distance challenge, and we are asking people to donate to the charity to support us. So you can find that on Just Giving, and it's also on our Facebook pages. Just another mention as well also about social isolation and the impact that this has on everybody's mental health. There's been quite a lot of talk this week about Terry Waite and what he experienced, and he's come out and given some hints and tips to people. So I just wanted to really urge you to reach out to people, to keep connected by any means that you can. And for some people, that is a landline telephone and looking out of the window, opening your window and talking to people. And for others, you really are engaged across all social media platforms. If you know there is somebody who might like to engage with Facebook for the first time, please pick up the phone and talk them through it. Anything at all to keep people connected. And if you're aware of somebody that does live alone and maybe more isolated than many of us, then please just make a little mental note every day, pick up the phone and have a little chat with them or connect with them in some way, shape or form. I just thought before I start going through some of the questions, I'd just talk a little bit about the Mesothelioma UK nursing team. We are in contact daily. We have a huge amount of support from each other and get an awful lot of support from each other, I should say. And our experiences are very varied across the country. So some of our nurses working in London are really at the sharp edge of the COVID crisis and seeing on a daily basis the impact of the pandemic. And then other nurses are working in more rural areas where the incidence at the moment is quite low. And so they're still much further back in their preparation stages. One of our nurses has returned to work in intensive care. Another nurse has joined her local palliative care team for the duration. And all of us are generally brushing up some of our ward-based skills so that we can be available. And like you and most of your families, we're also, busy working mums with sometimes elderly parents. And so we face all the same challenges that the rest of the nation are facing. But I just want to say how hugely proud I am of the Meso UK nurses, who absolutely hands down have just said, we're here to support our wonderful NHS and we'll do everything that we can. And we as a charity are doing all we can to ensure they can be released without any impact on the support and the information services that we offer as a charity. So please, don't hold back. If you need support and advice and you can't get hold of your Meso UK nurse, don't hesitate to pick up the phone to the free phone information line 0800 169 2409, or drop us an email on info@mesothelioma.uk, mesothelioma.uk.com, and we'll do everything we can to support you, as we always do. So I'm just going to go down to some of the questions that we've had sent in. So the first one is, somebody's been asking us that are they more vulnerable because they don't have a spleen? So just bear with me while I just get the questions up. And thank you to those of you that have sent them in. It's always really helpful to have them sent in advance. So am I more vulnerable if I don't have a spleen? And so those of you that have had that have got peritoneal mesothelioma and have had surgery for peritoneal mesothelioma, or some of you may have had other health problems, which means that you've had your spleen removed, then for those of you that have are living without a spleen, you will know that yes, you are definitely more at risk of infection, but the emphasis has always been on bacterial infection, and usually for a couple of years after you've had your spleen removed, you remain on antibiotics, and then thereafter you have an emergency pack. So what we would advise is, yes, you are more vulnerable and you are listed on the government website as being more vulnerable, and we would urge you just to make sure that you have got your emergency pack available to you, which includes an urgent supply of antibiotics. So we've had somebody ask, will I be able to finish my chemotherapy? Now, this is a concern for anybody, any cancer patient who has started chemotherapy immediately prior to or even during the current pandemic. And the advice is different for different cancers. So don't think that if you've heard somebody in another cancer explaining what's happening with them, that it may be applicable to you. And even within mesothelioma, what might be applicable to one patient won't be applicable to another. There are lots of different variables for us to consider, not least your other healthcare problems. It depends whereabouts you are in your treatment, and it depends what your response to that treatment has been, and also what we're trying to achieve with that treatment. So the bottom line is, when you ask the question, can my chemotherapy continue? There is no definitive answer that is suitable for everybody. And what we would urge is that you reach out to your cancer team, whether that be your oncologist or your cancer nurse specialist, and they will talk you through those options. And what I can assure you is that they will make a decision that is based on you as an individual, your disease, your health circumstances, what they're trying to achieve, and where you are in your cycle of chemotherapy. For some patients, your chemotherapy will continue. It may be that they have to make adaptations. They may have to add in additional drugs to support your immune system. They may want to reduce doses. And for other patients, they may think that they have reached a point where it is safe to pause the chemotherapy or to stop it for the time being. Another person has asked, I'm having immunotherapy, can I travel to my clinic for each session? So what we would say is, we would urge you to avoid public transport where possible, and if you're having immunotherapy and you're managing without too many side effects, as we would hope, then we'd urge you to drive yourself, fill your appointment, and arrive just in time. And don't linger about, and leave and follow all the hand hygiene regulations. If you're not a driver or don't feel able to drive, please get someone to drop off at the door. If possible, don't encourage them to go into the hospital with you. We like to keep footfall in the hospital down to an absolute minimum. It is possible they may make some adaptations to your immunotherapy. So they may want to space the treatments further apart. They may want to pause the treatment. But again, it's much the same as chemotherapy. They will make an assessment and be assessing the risks and the benefits, talking to you and finding a treatment schedule that is most appropriate given the risks of the current pandemic. And again, do contact your clinical nurse specialist or contact your cancer team, or contact us if you want to talk through it on an individual basis. But yes, you can travel, avoid public transport and avoid taking anybody with you to those appointments unless absolutely necessary. Somebody has said, I've got to stay at home for 12 weeks, but as I don't have one of the listed conditions, I'm not entitled to community support. I'm worried about how I'll get food if all the online spots are taken up following the MP's announcement. We've had a few questions about this, about getting yourself registered as an extremely vulnerable person. So I think we've had probably 4 questions about this very one topic. And we have to say we have found it confusing as well, but we have gone online and we have asked advice from benefits advisors. And what we're saying is that we would consider, so we've asked some cancer experts, and we would consider that somebody with mesothelioma is extremely vulnerable, and we would urge you to follow the shielding advice that the government have provided us with. Now, that said, there are benefits from registering as an extremely vulnerable person. Clearly, if you don't have any family or friends, anybody near you to help collect food or to collect prescriptions, or generally just to look out for you if you have needs, then that is a definite benefit, because you can tap into this whole army of NHS volunteers that are going to be supporting our extremely vulnerable. If you do have family and friends around you, but in shielding you as the vulnerable person, nobody is able to leave the house and nobody wants to come near the house, then the other added benefit is that you can access some of the online shopping slots that are being withheld and protected for those people who are shielding. So some of you will have received a letter from your GP and some of you won't, saying that you are extremely vulnerable. If you haven't, then we would urge you to register on the gov.uk site, and it doesn't give you a definitive list of all the health problems that would render you as being extremely vulnerable. But having looked at that list, we consider that you would meet the criteria for a severe respiratory illness. And it says in brackets, including, I think, cystic fibrosis and COPD. So that list, including, is not definitive. And we would, as a team of experts, suggest that you meet that criteria. So we would urge you to tick that box and then have yourself registered through that process. Having looked at some of the supermarkets' online shopping sites and apps, if it automatically tells you if you are recognised in their portfolio that they have of you as being vulnerable. If you're not recognised, then there is a free telephone number there for you as well. So please do give them a call. And obviously, I hope you're not kept waiting too long, but that's what we would urge you to do. So I hope that's answered the question for you. Another question, what changes are there to clinical trials? This is somebody who's on the Atomic study, the ADIPEG 20 trial, but concerned about regular travel to get their treatment. And if they don't attend treatment for twice, then they could, that renders them ineligible to continue with the trial. So I can't be sure whether or not they're going to make some amendments to some of these trials for those patients that have been unable to continue, but that is possible, and I certainly will be reaching out and asking some of the clinical trial investigators if they are thinking about making amendments to trials. It's always a balance between upsetting the possible outputs from the trial if you make too many amendments, but I will be asking that question. The other thing to just point out is whether you're on a trial or not, your clinical team are going to be assessing you as an individual and whether or not it is safe for you to continue. So the ATOMIC study is a combination of standard chemotherapy, so platinum, cisplatin and pemetrexed, with the addition of the adipag 20. Now, there are risks to your immune system of continuing with that standard chemotherapy in light of the current pandemic. And so all I can say is I don't know on an individual basis whether or not they're going to enable people to continue on the ATOMIC study. What I can say is that they will be assessing every single patient as and when they see them to assess whether or not it is safe for the patient to continue on that treatment. And they will be doing everything they can to ensure going forward that you can either recommence the treatment further down the line or look at alternative treatments once we're through the acute phases of this pandemic. Now, we recognise it's not ideal, and it just adds to the whole stress and fear and anxiety of living with a mesothelioma diagnosis. And I wish that I could say, hands up, that your treatment's not going to be affected. I'm sorry, that's not the case. What I can assure you is, though, that everything will be being done to minimise the risks and maximise the benefits for each of you as individuals. So I just want to check that I have got through all of these questions. Oh, one last question. My sister is currently in a rehab community hospital. The ward is now becoming coronavirus ward and the need to move her out. They're looking at nursing homes, but I wanted to know if any other options there may be for her. So if you have a family member who is currently residing in a community hospital as a step down or her rehabilitation, then it is worth considering hospices in your area. I know that hospices have been looking at their bed capacity and trying to do everything they can to support patients with life-limiting disease who would otherwise perhaps be in hospital for that particular part of their treatment or care. So it might be worth reaching out to your local GP or palliative care services or your clinical nurse specialist and just asking them what measures have been put in place locally to support cancer patients who are perhaps not fit enough to go home, but that was the intention. There's also hospice at home services that might be available to support people in an early discharge type of capacity. So for that person, please do reach out to your local GP, palliative care team or cancer nurse specialist and just ask them what measures have been put in place to support early discharge for cancer patients or those transitioning from inpatient care to home, because as I've said, I am aware that hospices are doing all they can to support the current situation. So with that, we're 18 minutes live. I need to wrap things up. There's just a couple of things I wanted to point out. The first thing is increasingly our NHS hospitals are becoming, are having more and more patients admitted with suspected coronavirus or confirmed. And we really, really want you to do all you can to avoid going into hospital. So please, as I've said, it's very variable across the country. Please use your community healthcare team, your GP services, your cancer nurse specialists. And if you do have any signs or symptoms that are becoming troublesome, please get on top of them. It's much better to nip things in the bud rather than let them escalate to a point where you become more acutely in need of intervention. So any symptoms, please nip them in the bud. Make sure that you've got a good supply of your medication available to you so that you don't run out and reach a crisis situation. Please follow the shielding guidelines as much as you possibly can to protect yourself from exposure to this virus. And if you do have any problems, even if you suspect it may be the signs and symptoms of the coronavirus, please do not bury your head in the sand. It's much better to get help and support earlier than letting a health problem escalate. So any problems at all, please reach out and do work with your cancer nurse specialist to help avoid admission and bring in all sorts of other resources that are actually available to you to help support you in your home. And then one final thing I wanted to say, if you are in the unfortunate situation that you do end up being admitted to hospital or being recommended to be admitted to hospital, please prepare for that admission. Most hospitals now are not allowing any visitors, and so you're going to be very reliant on the healthcare team that you come into contact with for provisions and supplies of anything that you need. So any unusual medications, please make sure you pack those with you. Make sure you take your mobile phone. Access to social media will be really important for you, and your telephone. Don't forget your chargers. And please make sure that you've got all the core contact details for your next of kin so that you can keep in touch with them just in case you end up being in for a few days. So with that, I would like to say thank you so much to all of those that sent questions in. I'm aware there's been some that have come in while we've been live on air, and we'll do our best to answer those and post some responses, and we'll also save them for our next live Facebook Q&A session, which will be next Tuesday at 11 o'clock. Stay well, everybody. Remember, we're here for you. It doesn't matter what your question or concern is, just reach out to us and we will do our best to answer your questions or concerns, or at least signpost you to another service, or we will try and find it from one of the experts that we've got around the country. So thank you. Bye bye. Bye bye.